Welcome to the final working session of the conference. This session is on the question of large-scale engagement of religious communities with public sector organizations. I'm absolutely delighted to introduce my colleague and my friend, Andreas Hipple. Andreas now works in Minneapolis with the GHR Foundation, and we're really pleased also to thank the GHR Foundation as a co-host of this conference. So Andreas will moderate our panel on scale. Andreas. Thank you.
Thank you, Jean. Thank you, Jean. And I do want to give a special thanks to Jean Duff for affording me the opportunity to moderate this panel, as well as all the members of the planning committee. Thank you. Let me invite the first three folks here up. And I'm actually going to sit down. And Andy, why don't you sit here?
Okay, thank you.
And then John, why don't you go? Great. I'm going to sit down, assuming the mic is working, because our IT specialists are doing a fabulous job, so thank you to them. We've heard a lot about why faith matters, and that it matters, and that it works. We want to know now, how can we work at scale? How do we do this in a way that goes beyond the small community projects or beyond the small conversations and gets to large-scale impact, measurable impact, however you want to measure that. To help us get started, we have, and I won't go into everyone's bios because you have them, and the one thing we don't have is time. So I'll just start it by turning it over to Sandy Thurman, who's Chief Strategy Officer at the Office of Global AIDS, the Global AIDS Coordinator, and a leader in this field for many years. So Sandy, why don't you start?
Thank you. We're going to use this? Okay, there we go.
Yeah.
I think what I'll do this morning is just reflect on some of the conversation that we've had in the last couple of days as it relates to going to scale, and just a couple of sort of random thoughts that came to me sitting where I sit now at the Office of the Global AIDS Coordinator. The first is that, we're talking about bringing these programs to scale or going to scale at a time where the gap between the rich and the poor has never been greater. We've got some wonderful examples of countries where we all serve that are reaching middle income status, but that doesn't. We do that in the shadow of this growing gap between the rich and the poor, which I think presents a challenge to us. That's the first thing. The second is that, particularly at PEPFAR and other programs as well, we've had to do a really take a really serious look at our resources to analyze, what we have, what we don't have, and find ways to leverage existing resources in ways that are unprecedented for us. And I think, again, as we move to scale, all of us are going to be in a position where we have to take a fresh look at what we have and what we need in the absence of a lot of new resources. That's the second thing. We have to find those efficiencies. Then it's so important. We've talked a lot about our history. It's really important for us to look at how in public health and poverty alleviation and all these issues that we work on, that we don't lose what the experience and expertise and lessons learned from before, but we don't want to get captured by that or stay wed to our history either. And I think that just calls us to be thoughtful and reflective in what works, what's the best of the past and what we need to do that's innovative and creative. I think that also we have to look at existing mechanisms. We've certainly done this at PEPFAR. I mean, some of you may know that we've had some pretty wholesale shifts in the way that we're expending our resources, and that's caused some challenges for some folks. But we really have to look at where we need to make our investments. How we best leverage what we have, and really look at doing wholesale renovation and recycling of our existing resources. so that we're sort of what we're doing in the environment we need to do in our programs. And the other thing that sort of struck me from the last couple of days is that as wonderful as it is to come to a meeting like this, that feels in some ways like a college reunion, because many of us have been working together, for the majority of our adult lives, or part of our adult lives. I think it's really, really critical that we think about new leadership, new engagement, new voices at the table. Otherwise, we get what I like to call Appalachian thinking. And that's inbreeding of thought rather than new blood in our thought. And we don't want to do that. So I just want to challenge us. We're certainly doing that in the AIDS business, and we have suffered from some inbreeding of thought in the AIDS world. So we don't want to see others do that. There are just two other quick things. One is that we want to make sure that we understand that we can't stop our work in midstream. It's malaria one day, it's AIDS one day, it's women and girls one day, it's this one. I mean, it's not that we all don't. I'm not making light of that, but in HIV and AIDS, for instance, we are no longer sort of the disease du jour, but we still have an epidemic to stop. So we have to know that we're not the most popular girl on campus anymore, but that work still has to be done, and we have to stick to it to the bitter end. The last thing is that in the conversations that we've had as people of faith, as institutions of faith, we still have to grapple in all of our conversations and the work we do with the people that we serve and the people that we leave behind. And that requires us to find a space to have really thoughtful conversations and ways that we can be in tension and in the space where we know we'll disagree, but we work on common ground. And we've had some of those conversations. We certainly continue to have them in the AIDS business, but I want to just challenge us all to realize that we have to serve everybody and that we can't leave anyone behind, and we have to be brave enough to continue to have those difficult conversations.
Very good. Thank you, Sandy. So we have to continue learning and not be afraid to drop the things we've seen don't work and take a future-oriented approach to this work. Ulrich Nitschke from the Deutsche Gesellschaft für International Zusammenarbeit, GIZ, is head of program, and we've been hearing a bit about our German colleagues' relatively newfound yet deep-rooted interest in the space of religion and development. And so I'd like to turn it over to Ulrich for the next comments.
Thanks, Andreas, for this nice introduction. Deeply rooted, that is exactly what I want to try to do without being perceived as a developmentalist literacy lesson. I still want to relay a bit to my own journey, and it starts all with 92, and maybe that relates a bit to what we called either religious literacy or developmental literacy, since there was not much talking about developmental literacy, even if I'm very, very happy about Catherine's panel this morning to remind us also on the risks and dangers and the policies in our cooperation. I want to start off with this Agenda 21, because for me it was the major motivation to get personally involved in development cooperation. After the East-West conflict was gone, this antagonism, like there was this euphoria in Rio to come together and say, okay, development, environment as two perspectives on the same coin, and we have to combine this. By discovering that out of the 40 chapters, 10 chapters looked at specific stakeholders. If you look into the 10 chapters, religious actors are not mentioned at all. Even if the Agenda 21 was the major innovation in development cooperation. It was the document signed up, committed to by 192 states. Local authorities, women, indigenous groups, youth, everybody had his chapters, but not religious actors. It took us maybe 20 years to understand. Others started earlier, as we know, to understand there is a group of key stakeholders in this process. But I want to raise it also because then another milestone in 2000, MDGs, a big launching understanding of that we have to look much more in developmental issues. This elevation of poverty is something that concerns us all. But then again, we discovered only one goal, MDG 8, concerns the donor community, concerns the North. This kind of misunderstanding led if you may allow me to say, one of the lessons learned, led to the debate on SDGs, on the new SDGs, the 17 goals that occur to every and relate to every and each of us. And I think that's a bit, if we want to talk scale of our impact in cooperation between religiously inspired and parastatal and developmentalists, then we have to look in what is new in these SDGs. I think what is definitely new and a big difference to the Agenda 21 understanding, even to the MDG understanding of development, is that all the 17 relate to all of us, let alone from which angle, from which motivation. We are looking at the major 17 challenges. If it comes to climate change, if it comes to poverty elevation, this framing of another 15 years should raise our understanding that we all work on a common program. And this is what I want to encourage us to do today. If we talk scale, then we should not distinguish between all these different stakeholders anymore, but we should think how we can commonly, with all our different roles of responsibilities and unique selling points, our very specific approaches, but cannot tend to separate, but to work together on this one goal to achieve the 17th. Thank you.
Great. Thank you very much, Ulrich. Dr. John Blevins, from the Emory School, from the Interfaith Health Program, is going to guide us through a very, very brief overview of the evidence around scale for religious action in health. And John, feel free to come up to the podium because I know you have a few. You may have a few slides.
I do have a few slides, but I'm not going to break this tradition in this president. I'm just going to sit here because my slides are brief and they're on the portal and you can see them. So I'm just going to reference points I make on the slides and talk about some of their implications. Christo spoke yesterday, and he put on glasses to reference me. I racked my brain to think what I could do to reference Christo, but I couldn't think of any prop that would make me that handsome. So, okay, so this is all you get. I work, as Andreas said, in the Interfaith Health Program, and we have worked with PEPFAR for a number of years to help PEPFAR to build and strengthen its engagement and its partnerships with faith-based organizations, mostly in Kenya and in East Africa, but in other parts of sub-Saharan Africa as well. Our program works at various levels. So we work at the local community level, the national level in terms of doing some analysis of health outcomes, and then building international and regional and international networks. So I want to speak across that. I first want to say what we know and what we don't know in regard to evidence if we're talking about scale. Jill Olivier has done absolutely essential work to demonstrate for us that there is a lot we simply do not know in quantitative ways in relation to data of the scope of the contributions of the faith-based sector. She's already gone through that. But in my slide presentation, you can see a reference to an article that she and Quentin Woden wrote that lays that out. And I think we need to acknowledge that there is just a real limit to what we know in relation to the contributions of the faith-based sector. That said, PEPFAR did ask us to carry out a pilot project to try and quantify the scope of the contributions of the faith-based sector and faith-based health facilities in particular in Kenya. And there are ways and there are contexts in which that work can be carried out, and I think it's important to do it. What that work showed us is that in Kenya, about 30% of all HIV service delivery is carried out by faith-based health facilities and faith-based organizations, and that varies greatly across the country. In Nairobi, that number goes up to about 60%. So more faith-based facilities provide antiretroviral medications to people than do government facilities in the county with the highest HIV, a number of people living with HIV in the country. 2/3 of faith-based organizations in Kenya are providing some kind of HIV service, and faith-based organizations comprise over 70% of the public, of the private sector, not-for-profit sector, providing services to those most vulnerable and poor. If we can get those data and those numbers, I think that's important, but we have to recognize what we know and what we don't in relation to that. On the qualitative side, we know that faith-based organizations engender trust in specific ways through case studies. But is that at scale? Is that across the board everywhere? And what we also know is that it is not, and it's not universal. We know that faith motivation may contribute to trust, and faith motivation may also contribute to stigma. And we've alluded to that before. And so we need to understand the functional impact of faith-based organizations in that mix and in that variability. When we think about going to scale, if we're going to engage the faith-based sector, we have to understand that the ways that religious faith and religious belief can contribute to stigma in relation to HIV for those who are most vulnerable to infection and have the highest prevalence rates and incidence rates, men who have sex with men and sex workers and drug users and young women, that teachings in religious traditions may contribute to stigma that then translate into barriers to care and into dropping out of care. What I think are the important questions in front of us from a research standpoint and from the side of our academic partners. If we're going to think about scale, we need to understand the characteristics of our unaffiliated FBOs. And I think actually that's an incorrect term. They're affiliated. They're part of robust networks themselves, but we don't know about them because they're not part of the networks we know about and that are represented in this room. And so mainline Protestant and Roman Catholic health networks we know a good bit about in the country of Kenya. We don't know about independent evangelical or Pentecostal organizations. We don't know about non-Christian organizations, and we need to understand what they're doing, how they operate, how they function, and the impact of their work, and we don't know that very well. We also don't know much about traditions outside of Christianity. We talk about engagement with faith-based organizations, but 99% of that is partnership with Christian organizations. And that's great. I say that as a practicing Christian, but we have to know more about the organizational structure and the ways that other religious traditions carry out their mandates as people of faith to care for those in their community. In relation to that, I want to echo Sandy's words of asking ourselves an important question of who's not at the table, who's not here right now, and that's both in regard to religious traditions other than Christianity and Christian communities that aren't traditionally represented. To think about if we're going to scale and the impact of religion, what are the impact and the effects of religious faith and belief and practice in people's daily life, and not just about provision of healthcare services. If someone in Kenya goes to a traditional healer as part of a regular practice in their life, what we tend to think about is that going to create problems with their antiretrovirals? But they're going to a traditional healer may actually be a preventive factor in relation to daily health and wellness. And we don't know much about that. And we've got to find better ways to understand the impact of religious practice and religious devotion on health and wellness in general, and not just in response to disease. And then finally, the question of moral vision and the question of hard evidence, quantitative data versus moral vision of religious traditions. We simply have to keep at the hard work, and we're doing it, but we have to keep at it, of finding a common ground where we can value and honor and give proper impact to both of those. And in relation to that, I just want to name 3 questions that are moral questions for me as a person working in academia and goes to other parts of the world to do work that I think are also ethical questions about how you do your work. First one is, what shall we do with the existing tensions about differing religious beliefs in relation to contentious issues? The ones we all know about are in relation to gender and sexuality. We talked about that a bit, but there are others as well. And what do we do with those tensions in regard to how they are, the variability in religious traditions? And what do we do with those tensions between what are the priorities of secular civil society funders and our engagement as faith-based players in relation to that? And how can we understand the implications of this in relation to programs? Religious teachings will be protective factors against HIV infection. Abstinence can be a protective factor, and abstinence teachings or abstinence teachings alone may also create vulnerability for infection and be drivers of HIV risk for those who don't maintain abstinence. Do we create vulnerability by making assets visible? Our program has a history in working with RHAP in religious health asset mapping. If we put things on the map, particularly innovative programs that are cutting against the grain, that are doing important work in informal settlements or working with men who have sex with men or sex workers, and we make their work visible, do we create vulnerability for them in their own religious traditions by saying, this is what your brothers and sisters in your faith tradition are doing that might be in tension with the teachings of your tradition? What does it mean for us to think about those innovations and want to take them to scale, but create vulnerability at the same time? And then finally, do we speak about partnership, but end up practicing co-option? Activities of FBOs may align with the priorities of our program, but what motivates FBOs to do that work and people of faith to carry out that work may not be our motivations. And a lot of times when we think about taking things to scale, we end up not only bringing programs into networks, we assume that their motivations are ours and that we share the same agendas. We need to be clear and careful that we recognize that there may be important differences in regards to what is the foundation of our work, and not assume that those of us coming from universities, global funders from this part of the world, that our motivations, our priorities, our agendas aren't setting the stage and aren't overriding theirs. Thank you.
Thanks, John. So those are some of the major challenges we have as we think about scaling up and even as we think about innovative work that potentially could get scaled up. I want to thank the initial 3 people up here, and then in the interest of time, keep talking while we transition. So we will ask the 3 of you to step down briefly, and the 6 people who will be speaking subsequently, all to come up at the same time. Just to save time. So what we're going to do now is get into, please. We're going to get into concrete examples of efforts to bring faith-based engagement to scale. Some of these efforts do address one of the issues that John just mentioned about how do you do work at scale that isn't just in the Christian community, but as actually bringing in intentionally traditional communities, Muslim communities, other faiths, Hindu faith, I know is part of the Mozambique case. And well, I think we're ready. I think we have everyone. And so thinking about responding to what is in the McKinsey report, which is that policymakers and funders want to work at scale, so we know that. We know from the presentation that Jean made yesterday, based on the Lancet article that she co-wrote, that there are coordinating mechanisms out there. There are ways to do things at scale. So let's hear about some of the specifics. So I want to thank the 6 of you for joining me up here. And we're going to start with David Sutherland. And to begin with his story from lands far away. Please go ahead.
Thank you very much. This has been a great couple of days for me, so many academics and development professionals in the room. It's not really my background. Not really sure I belong here, but no Appalachian thinking going on here. I spent the first decade of my career right here in Washington, D.C., working for a couple of Wall Street law firms, and then I worked for the Clinton administration. And then in 1997, I moved to Hong Kong to work with Morgan Stanley. And eventually, I became Morgan Stanley's chief financial officer in Asia Pacific. I was overseeing all the financial affairs of a multi-billion-dollar Asian financial services firm. And but on nights and weekends, I invested heavily in a charity in the Philippines that fights poverty. And so then 2 years ago, I left the business world completely in order to focus on poverty reduction full time. And in this capacity, I kind of represent a group of Asian investment bankers who want to help the least fortunate. For those of us who live in Asia and we travel from city to city to city, we are constantly confronted by poverty. There are more extreme poor in Asia than almost twice as much in Asia than the rest of the world put together. So by sheer numbers, we kind of feel that extreme poverty is primarily an Asian problem. So we started by focusing on the Philippines as an incubator about how to address ultra poverty. So we leverage on a charity that is called International Care Ministries. It exclusively works with local churches in the country, and ICM has grown explosively. Now it is one of the largest local charities in the Philippines. And we've chosen to focus our efforts specifically on the ultra-poor people in the Philippines. That is, those people who live on less than 50 cents a day. And investment bankers like us, we kind of have a voracious appetite for metrics. So over the last decade, we've accumulated about 40 million data points from the poorest people in the Philippines. And our data shows that among our target population, those that earn less than 50 cents a day, that the average daily income is only 26 cents a day. That most of these people lived in cramped homes. They don't purify their water. They live without electricity. So the question then is, how can we use our business skills to address a problem of that magnitude? Well, in our business lives, when we evaluate a new venture, we usually look for two different things. First, we look for a great product that meets the need, and secondly, the ability to scale that product. So for the first, so when we decided how to work on that in the poverty area, after we needed a great product to fight poverty. So after nearly 20 years of experimentation, and we have had cycles of Hong Kong investment bankers, including investing more than $50 million of our own money, we have concluded that we can achieve the highest return on our own investment by using a faith-based distribution system. Now, that is a different conclusion than many other agencies come to, and we completely agree that aid needs to be delivered impartially, but many global agencies decide that they should be neutral with regard to religion, and they define neutrality as prohibiting the discussion of faith during the programs. But in our view, excluding the discussion of faith is not being neutral about faith. For most poor countries around the world, bringing a God-neutral message is not culturally appropriate. It is culturally inappropriate. It is people from a faraway land trying to impose their secular worldview on local people who deeply believe in the divine. So how does that play out for all of us? ICM has designed a church-based 4-month intensive program we call Transform. In each community, the local pastor and 6 members of his community invite 30 ultra-poor people to once-a-week training in values, health, and livelihood. And at the end of those four months, we see amazing benefits from this Transform program. The average family has a 95% increase in household income, 31% fewer people live with serious illnesses, there's a 27% reduction in those going to bed hungry, and scores of other improvements as well. And surveys after that time, up to 3 years after the conclusion of the 4-month program, shows that most of these improvements continue. You know, yesterday one of our presenters said that we should focus on 2 words, hope and dignity. And we completely agree. The most important single lesson that we've taken from these 2 decades of experience is that hope is the key to freeing people from poverty. People who live in extreme poverty, they experience extraordinary stress that can paralyze action. In ICM's communities, 24% of all mothers have had one of their own children die, and 8% have had more than one of their children die. That is an extraordinary amount of stress that can affect entire societies. We've concluded that the underlying causes of poverty are often rooted in fatalism and lack of optimism. The key is hope, injecting optimism. And faith communities are uniquely qualified in this area. Spiritual leaders are in the business of injecting optimism into people's lives. After Transform, our participants report that there's an increase in satisfaction of their families, and our regression analysis demonstrates that this factor, satisfaction with family life, is the single factor that drives the rest of the positive outcomes. For example, research shows that participants who improve their family relationships are more likely to guide their children out of malnutrition. Another bit of research we did said that strong family relationships make poor people to be more willing to be tested for tuberculosis. When people trust each other, they help each other. People share, lives are saved, and we just cannot underestimate the significance of hope. So as business people, hope is the product that we need to deliver in order to address ultra poverty. So that leads to a second requirement, then how could you bring hope to scale? Well, in the Philippines in particular, we have discovered that there are small churches on almost every Philippine street corner. And most of these churches are run by very, very poor pastors who are passionate about helping other people. Now, before ICM ever arrives, this local pastor already knows the first name of every person in their community. We've also discovered that pastors tend to be the most enterprising people in their entire communities. They start things all by themselves. But many of these people, they have chosen to live their lives based on gifts from their ultra-poor congregations, often only $2-3 US a week for their entire family. And as a result, their entire families endure many, many hardships. But despite these struggles, most of these pastors are very grateful to work with us to help their communities. These pastors are our heroes, and we believe that it would be virtually impossible to replicate this church-based distribution system by using secular means. At great cost, the secular program could try to hire social workers to travel to visit all these poor families, but these expensive social workers would not have pre-existing interpersonal relationships in the community. In fact, our research shows that for the effectiveness of our trainers is inversely correlated with their level of formal training. For every additional year of our trainers' formal education, there is a 10% reduction in the effectiveness of the program. So we conclude that less educated local faith leaders will have more impact than highly educated imported social workers. Now listen, so what does scale mean for us? ICM focuses our efforts on 15 Philippine provinces with a total population of about 17 million people. These provinces contain 1.7 million people who live in ultra poverty. We want to scale up our programs to reach these 1.7 million people. They are ICM's target audience. Now, just for context, in May of 2015, ICM graduated the 600,000th family member from this 4-month training program. That means we've reached more than 1/4 of all of the people, ultra-poor people in our provinces. And that is an astonishing amount of scale, and we think that would not have been even remotely possible without cooperating with local faith communities. But business people are not satisfied with just raw success. We want to compare our performance against an index or against a benchmark. So how can you to benchmark ICM's effectiveness? Perhaps the most secular poverty reduction strategy for ultra poverty in the world that we're aware of has been run by BRAC. They've run 1 million family members in Bangladesh through it, plus that model is basically being piloted in a couple of dozen countries around the world. On May 15th, just 2 months ago, a 6-country randomized control trial was released. It was published in Science magazine, and it showed that this BRAC program works, and that the average family that goes through the BRAC program for 2 years earns about $300 of extra income for each poor family. But to bring this program to those poor families, it costs $1,000, $2,000, $3,000 per family. So to take 1 million poor families through a program this expensive would cost more than $1 billion. Now, in early 2015, ICM partnered with Yale University to run our first randomized control trials, and the statisticians are still analyzing the data. The findings will soon be prepared for publication, but our preliminary analysis shows that an ICM family would earn $361 more per year if they had not participated in our 4-month training program. That means that Transform also improved the satisfaction with family life and positive change in food security and access to water. And if you want to see fuller results, they only gave me 8 minutes, so they're in the appendix, which is all online. But if you compare ICM's results to the secular BRAC program, we are working with the very same researchers from Yale that studied BRAC, and our preliminary results indicate that ICM's program has a similar impact in freeing people out of ultra poverty, $300, $400 per year impact on the families. But ICM incurs a little over $50 per family to deliver our program, not $1,000 per family. Thus, ICM's programs generate nearly a 50-fold better return on investment compared to the secular programs. And I want to emphasize that our results are preliminary. The statistician's still working, but the data does show an astonishing disparity in bang for the buck. Now, the question then is, how could ICM possibly achieve a similar result to the best-in-class secular programs in the world for only a tiny fraction of the price? That is easy. We think that faith-based distributions create scalable, high-impact solutions to poverty in a way that is impossible to replicate with secular means. And we think that leveraging on the local church networks have the potential for changing a lot of lives. If you just look at ICM's efforts over the last few years, our research projects that 41,000 people today have fewer suffer from hunger every week, 57,000 endure purified drinking water, 34,000 fewer live with scrapped roofs, more than 150,000 people have been freed from ultra poverty. And many of you today, I know, are waging a war on poverty in your own faith communities, and we would look forward to a conversation and hope that this gives you a little ammunition as you explain to other people why the use of faith-based communities is important. Thank you.
Thank you, David, and I absolutely commend you to the website, and David and several other presenters have provided really rich materials, as many others have done. So, Mark Webster, CEO of ADRA Australia, I'd like to ask you to then provide a few comments, and you have about 5 minutes. So, thank you.
All right, thank you very much. I want to preface my comments by thanking David for his presentation, and he was kind enough to share with me some of that information earlier. So some of my comments will be reflective of what he's shared. Some of them are based out of the Papua New Guinea Church Partnership Program, which Joanne Ronalds mentioned yesterday, and which ADRA Australia is heavily involved in. And that's a program that works at scale in PNG and is grappling with the issues of how to do that well, where we're succeeding, where we think we can do better, where we need to do better. And so what I'd like to do is share just 4 key factors that I think are important things for us to be considering as we're looking to work at scale with faith communities. And the first of those, and it's one that David, I think, has highlighted, is that if we're going to do this, we need to be measuring and communicating our effectiveness. And I say measuring and communicating because it's one thing to measure, but if you measure it and don't communicate it, that's not going to help us get to scale. We need to have key stakeholders aware of what is happening. People tell me, well, your church partnership program in PNG is your best kept secret. Well, it shouldn't be a secret. It should be something that we're communicating effectively. But it's not necessarily easy. Particularly as we go to scale. In fact, I think the measurement challenges get harder. And I would suggest that there's probably a couple of things that we can look at around that. I think one is that we need to be innovative. And again, I think David's presented a good example of that. We need to be innovative about how we measure. We need to be coming up with new ways of doing that. So that we overcome the challenges of working in a place like PNG where you've got multiple language groups, you've got inaccessible geography and people spread out all over, and you're trying to measure that. We can't just do it using the same ways that we were measuring things 20 years ago. We need new ways of doing that, and we need to push the boundaries all the time and learn from each other. The other thing I think is we need to focus that measurement. Again, when you work to scale, as our program does with 7 different churches doing a whole range of activities all over the country, there is no end of things we could be measuring. But we need to pick those things that are important. And again, I think David illustrated that. The second factor that I want to talk about that I think is really important is around building and maintaining relationships. And that's something that I think in PNG we've had really good success with. It's something that a lot of time and energy has gone into. And I think there's nothing that's going to test relationships across faith groups and between faith groups and government and private sector more than trying to scale something up. And if you don't have that strong foundation of relationships, of understanding, of shared language, of trust, I think scaling up becomes really problematic. And so I would argue that the things that we need to be looking at there are one, I'm going to say translation. And it's come up over the course of the last day or so, this idea that we need to understand each other's languages, that we need to be able to speak to each other. One of the factors that I think has been successful in operating, a cause of being able to operate successfully at scale in PNG has been the role that Australian NGOs that are faith-based, that have the relationship with the churches already, but also have the relationships with the Australian government, that can translate, that know both languages, have played. I think that's a key role. And the other thing is time. That program's been running for 10 years. It didn't start out with the strong relationships that it has now. But one of its greatest accomplishments is that you have the leaders of 7 different denominations that in theory could be in competition with each other in PNG, or certainly working in isolation, getting together more than twice a year, to collaborate, to support each other, to work together. And I think the relationship with the PNG government and the Australian government is important there too. The third factor that I want to raise is that faith communities are a starting place if we're going to be scaling up, not just a means to an end. And the word instrumentalization was raised this morning, and I think it's that thing that will not work for us. If we're simply seeing the faith community as a means to an end, as a way of getting something done, we're missing the opportunity for scale. Now, in PNG, faith communities, churches are already working at scale. Across the country in the areas of health and education, 50% roughly in both of those areas of services being provided. And a lot of credit goes to the Australian government for following a partnership approach, a genuine partnership approach, of not just seeing this as a way of delivering their objectives into PNG, but of genuinely working with the churches to do that. And that's not necessarily an easy thing for a government bureaucracy to do. It goes against natural tendencies, I think, and they've resisted those temptations to just try and see the churches as a means to an end and have genuinely engaged. And I think that has been a really important factor in what is a genuine partnership. The last and final point I'm going to make is around organising and structuring efficiently. I think as we go to scale, that becomes a really critical question. You can get away with a certain amount of inefficiency at smaller scales, but once you want to go larger, efficiency becomes key. And again, if you're going to scale, you're probably working across denominations, across faiths. And that's one of the areas that I think we're working hardest on to come up with the right solutions for how do we structure ourselves so that we have effective decision making, effective measurement, ways that we can take things that we have in common and roll them out across all the churches. Those are the challenges. And I think clarity about roles is really key in that. And I think leadership is absolutely essential, both in engaging leadership, but ensuring that there is strong leadership across the program. So those are the 4 points that I'd like to raise. Thank you very much.
Thanks very much, Mark. And we've heard when you go to scale, then you're probably working across faith lines and across denominational lines. So let's go to Nigeria, and Bishop Sunday Onuoha, Executive Director of the Nigerian Interfaith Action Association. And you could take either speak there or there, wherever you are most comfortable.
Okay, let me.
Very good.
We just like to stand. Well, thank you, and I want to thank Jean and all those who have worked so hard to put this project in place. And I think there are 3 things required in interfaith and collaboration. Number 1 is trust. Number 2 is teamwork. And number 3, evidence. And what we've done in Nigeria is where we were able to put together a team. People trusted, and we were able to show some evidence to show that things can work. And those of you who probably know Nigeria very well know that Nigeria is the only country in the world that has almost equal number of Muslims and Christians resident in the same country, almost 170 million people in one country, 50% Muslims and almost 50% Christians. Maybe in some parts of the world you have more Christians, in some parts you have more Muslims. So to pull all this together with a language of over 250 languages and over 250 tribes is not easy. But we realized as people of faith that malaria, mosquito, was killing about 300,000 people every year. 300,000 people every year. And so we knew that we have something to do and that we need to engage people of faith at the highest level. We have to bring Muslims and Christians together. The Sultan, the #1 Muslims in Nigeria, and the #1 Christian in Nigeria brought everybody together, including our international donors who have confidence in Nigeria, who believe that something has to be done to address the situation we find ourselves in Nigeria. Unfortunately, what people hear about Nigeria is about extreme Islamic Boko Haram that is destroying thousands and thousands of people. But people don't hear wonderful things and many things happening in Nigeria, how Muslims and Christians are working together. how we are marrying each other, how we are celebrating Ramadan together, and how we are celebrating Christmas together as a people. The international news does not carry that. But how we are living together as a people should be made public to the people. And so, World Bank, USAID, Global Fund, they were going to put in so much money into Nigeria. But the problem was that the people were not using the net. Mosquito was killing 300,000 people, and the international donor agencies were going to send in a lot of mosquito net, spend millions of dollars into Nigeria. But the previous experience has shown that when they send in these nets, people were not using it. Therefore, we developed a language. And that language is that mosquito is a Muslim and mosquito is a Christian. Mosquito on Friday, we go to the mosque. And mosquito on Sunday, we go to the church. And so mosquito knows interreligious dialogue. And as such, if mosquito knows interreligious dialogue and knows on Friday how to bite an imam, and on Sunday we bite a pastor, and they will all die together. Therefore, we must develop a strategy that will attack malaria. And so we have evidence-based, as I talked about. Before we went into NIFA engagement, we had a situation where in the same region, one state that was not, NIFA was not involved, had 25% evidence, and the state where NIFA was involved had 51.6%. So our business is to ensure that we reach out to the communities. As of today, NIFA started in 2009, and I'm glad Dinis is here, who was one of those that fought so hard for us to start. By 2009, when we started, until now, we've trained over 250,000 pastors and imams. We produced what we called the Mosquito Holy Book. And the Mosquito Holy Book is the toolkit that has Quranic references and Bible references on what mosquito does and what malaria does. And it will surprise you as a Muslim to go to the Quran to discover that malaria was involved in Quran and to see that there is malaria in the Bible. And we produce it, and so every preacher has the toolkit in his hand. So when they came for the training, they were participating in the training, and when they go back to their mosque and their churches, they were preaching and they were talking from that sector, from that holy Mosquito Holy Book. Now, what made our work so successful is the level of engagement. We made sure that the highest level of leadership of Muslims in Nigeria were involved. The highest leadership of Christians in Nigeria are involved. And the federal government, through the Federal Ministry of Health, they were involved. So everybody came together as a team. And when I talk about this, a team, this team must be trusted, this team must work together, and there must be evidence to show that this team knows what she's doing. The faith community is trusted by government, the faith community is trusted by donor agencies, and we are also trusted by the communities, the recipients. And as such, when we come to a community, we get the pastors, we get the imams, we train them and move them back to their congregations. They became our foot soldiers that have helped. In the recent survey that is conducted by the World Bank that has just been released, it shows that the places where World Bank has utilized NIFA to do their work, it has scaled up. And so USAID has engaged us right now, and the Global Fund has engaged us to go into those states that have not reflected this kind of work. And so we are glad that the UN Special Envoy on MDG and everybody who worked so hard to bring NIFA together, the Tony Blair Foundation, Tom Woods, and all of you who put together this great team to respond to the very situation in Nigeria to ensure that 300,000 people stop dying because of malaria, that this work has been successful, and we are thankful.
Thank you, Bishop. Thank you, Bishop. And we'll go down to the other end of our group here, and feel free to come up if you'd like, but It's Renier from National Religious Association for Social Development, where he's CEO in South Africa. Please.
Thank you very much. I will link on to the remarks of the example of Nigeria. What I've written as a response is also available on the net, so I'm not going to refer to that. The response in Nigeria is a good example how you create a national network that is able to do things at scale if you have a common vision. And the best way to foster interreligious cooperation is to work together. And what they've done is a good example of that. It's very important that you should have a common vision. You have to have shared values of what you're doing, even though there may be many denominational differences. You have to be serious about this, because if you're not, you'll get into trouble if you work with different governments. So the whole issue of joint action, shared values, despite differences, to build that common understanding is very important. When we started our own network, Nelson Mandela was the president, and everybody wanted to work with him. We're now with a third president, and we just saw along the way, not all of them have the same understanding of partnership. So if you're not sure about what is your common base, you are very in danger of getting co-opted for political agendas that not really will serve your end in what you want to do. So I will limit my remark to 3 issues. The one already I've said, for a national interfaith network has advantages if you can manage to get common visions and work together, and in this way you also grow trust between different faith communities. We've seen that. We've been going now for 18 years. The second point, 1 or 2 remarks about government, liaising with government. You have to liaise with government because they're responsible for policy. And they're the point of entry for international donors. But it may also be a danger. And you should never expect favors from government. We want good governance and transparency. Because if you expect favors, you will just get into trouble. You have to have good systems to protect government and to protect yourself. And what we've done in managing a Global Fund grant is we've built the capacity of one another. Especially the Catholic Church was used to work with PEPFAR. They had a lot of practical experience. We used their experience to build the experience of many other churches that for the first time had to work with Global Fund grant. Sharing that experience has made us strong, but also helped us in our dialogue with government. We had rough times, we had good times. The moment your faith leaders start criticizing government for corruption, expect trouble. We've lost huge grants because of that. But your credibility is more important than being an instrument for a donor or for government, because otherwise you cannot serve your community. Last point, if you're a national network, you must ask yourself critically, are you a filter, a gatekeeper that keep funding away from small communities? Or are you a booster that really multiply the possible effect? We don't like intermediaries that function between donors and our faith communities because they have their pet projects. If you don't know their jargon and you don't know the leadership, it's very tough to get it through to where you want to. But if you're a national network, you have always to guard that, are you playing the same role or not? In our own case, we've delivered education programs for many communities. None of them were members of us. So in our case, we had a principle that if we want to strengthen the work of communities, they don't have to be members of us. A last point, working with international donors is wonderful, but it can be a risk. And often narrowly defined vertical interventions does not build trust at community level. We've seen this in the Global Fund grant we manage when the country coordinating mechanism is shifting your work from one district to another. How do you explain to a child in one district, an orphan, that it doesn't qualify for support anymore because the infection rate or the rate of poverty in a different district is now regarded higher and you have to shift it? It totally destroys trust at community level and trust into your own networks. You may fulfill all the formal criteria, have good financial management, tick off all the boxes, and miss the elephant in the room, that in substance you're not changing anything. I say this because sometimes I think it's a challenge for us working in this area that you learn to read donors and what they want. It's very dangerous. We also always have to read what are the needs on the ground, and do we really respond to that? And are we effective, or are we a barrier in this process?
Thank you. Some challenges in that. And clearly, the issue of trust, as we've heard from several of our speakers already, is potentially in tension with efforts to scale up, because it's hard to scale up trust. Also, interesting comments on working with government and with donors. And clearly, there's a need, as we heard from our Norwegian colleague Svein yesterday, there's an interest in international agencies in partnering around the anti-corruption issue, and it's an interest that many of us have. So understanding the political economy of the dynamics of scaling up national coordinating mechanisms and their cooperation with national government, there clearly are tensions and challenges as well as opportunities there. Let's turn to Abagail. Abagail Nelson is Senior VP at the Episcopal Relief and Development Agency, based in New York. Please.
Thank you, everyone. I echo the enormous thanks and gratitude to Jean and to all at the Joint Learning Initiative and the World Bank for pulling us together for this conversation. It's really been very rich. And I'm also very grateful to my fellow panelists who outlined common vision, trust, teamwork, evidence, which are all themes of the presentation that I wanted to share with you. My day job is I work at Episcopal Relief and Development, which is the relief and development agency of the Episcopal Church. The Episcopal Church is a branch of the wider Anglican Communion, which is the Anglican churches around the world. And so Nets for Life became a program which involved a coalition of many partners. And an Episcopal Relief and Development served as kind of a secretariat for a coalition that I want to share a little bit about, how the coalition came together and really what we achieved. In coalition building, someone else has said it's important to ensure clarity of roles. On that table in particular, I want to say that Nets for Life came into being because of originally one person who saw a child die of malaria and thought, we need to do something about this. And so at the end of the day, people are also extremely important. This particular person then said to us, what can we do? And he helped us at Episcopal Relief and Development connect to some financial resources. Next slide, please. And I just want to mention those particular resources because they are extremely important and point to coalition building. Standard Chartered Bank, the Coca-Cola Company, the Star Foundation, ExxonMobil, UNICEF, Global Fund. Over the years, we developed a variety of funding partners for a coalition. We also worked quite closely with, over these years, those groups who work on frameworks for evidence engagement and monitoring and evaluation when it comes to addressing malaria globally, the rollback malaria community. And in that, the common framework for the setting of indicators and the collection of evidence, I think, has been tremendously important in terms of our capacity to tell a common story. So there we have partners in rollback malaria, we have the Ministries of Health, we have national malaria control programs, we have the Alliance for Malaria Prevention. And then finally, which is part of the theme of this particular presentation, are the people and the boots on the ground who actually are doing the work of ensuring that people continue to learn about malaria, protect themselves from malaria, and seek treatment if and when they get bitten by the unholy mosquito. And those are the clergy of many faiths, including in our coalition, the Methodists, the Episcopalians, the Anglicans, the Muslims of a variety of types in the communities in which we work. The mothers, the grandmothers, the traditional leaders. We took a huge, wide, pardon the pun, net to looking at who could participate in this particular program. Next slide, please. So at heart, Nets for Life is a social behavior change program. People not only need to receive nets, many of us have talked about the delivery mechanism for health. So people not only need to receive at the end of the day the delivery, but they also need to sleep under the net. And that at the end of the day is a barrier to ensuring that people protect themselves. And so at heart, if you wouldn't mind clicking the slide. Another click, please. Thanks. So at heart, social behavior change has to address knowledge, it has to address approval, it has to address intention, it has to address practice. And so you have to be able to engage at home level with a variety of areas around all these particular components. Faith leaders and traditional leaders are critical to ensuring that people at home level practice something. It's not just that they receive the net, as I mentioned. It's not just that they know that the net is good and that it's important because it addresses malaria. It's that they actually open the net, that they actually hang it over their sleeping places. They actually get in under the net at a particular time every evening to protect themselves. And these are complicated things. And so engaging faith leaders on the communication messages that people like Bishop Sunday just shared, ensuring that the traditional leaders at community level understand the use of the nets, knowing, engaging all women and mothers in a community and fathers and everyone really to understand the point of the net is what our work has been about. We do take a socio-anthropological approach to behavior change and understanding who are the trusted actors. And trusted actors differ per community. So we can't just say one particular faith is the right faith to work with, and even in a particular community, you may need to work with multiple actors, but the coalition is the key. The other point I want to raise are barriers. So when you work, as we did in a 17-country-wide nets distribution program, there are you come across a variety of barriers, so you have to be constantly looking at your program and listening to the people as to why they aren't sleeping under those nets. And some very simple things will come up. It's too hot. So we have to talk about the heat. We have to talk about what you do during the heat seasons and the rainy seasons. Color was an issue. There are certain communities that don't want to sleep under white nets because they resemble death shrouds, so we needed to look at green nets in those communities. The logistics of hanging the nets. We had children who would come to school and say, I didn't sleep under a net last night, so then we would have to send a community agent to the house of the child to understand what's going on there. And then in that particular house, you would find that the grandmother had maybe taken the net and been very preciously laid it over to the side because she wanted to honor the net, but she didn't pull open the package and she didn't string it up. And then if you discussed with her why she didn't string it up, you would find she didn't have string, or she didn't have hooks, or maybe she couldn't raise her arms up because she was dealing with some physical incapacities. So, at a very, very elemental level, when we look at behavior change, we have to go deep into the household and deep into the home if you're really listening to people. And so that's been the work that we've been engaged with our multiplicity of coalition partners over the past 8 years. And the results of some of that work, next slide please, is that we have distributed about 22 million long-lasting insecticide-treated nets in 17 countries in Africa. The coalition has sensitized over 41 million people to malaria. And in the collection of the evidence around what works, we've been very engaged in this conversation about, is fixed point net distribution the right way to go? Is it cost effective to go household by household? We've gathered evidence and we've sat in those meetings at the Alliance for Malaria Prevention in the variety of places around Africa and the various national malaria control programs to say actually household hang up is the way to go if we're really wanting to talk about reaching the last mile. And so I would encourage us all as we think about building coalitions to invest in evidence gathering, but also invest in the people and the capacity to sit in those meetings and constantly have those arguments because they're there and they're important, and everybody has their stake in how the evidence works, and particularly on cost-effective issues. Next slide, please. This is a slide that comes from Angola and sort of speaks to itself. It's an example of what's happened in the communities where we've worked. In this particular, some of these communities, this evidence comes from Uige Province, Sango, and Mukaba municipalities, where USAID was also a coalition funding partner and support. One thing I want to share about this, and again, when you're talking about going to the end of the road and the last mile and sustainability, is that although these graphs look fantastic, there is still, the extra % at the top that isn't being reached. And just a personal anecdote is, I went to Angola, a year ago to celebrate some of these findings and to meet with the communities and listen and talk and discuss. And the day I arrived in Sango municipality, all anyone could talk about was that 2 children had died the night before from malaria. Everyone had been educated, everyone had nets, everybody, had been part of these programs for years, and yet 2 children the night before had died from malaria. And so, we had to we had to deal with the emotion of the moment. We had to honor it, we had to pray with people, we had to engage. We then also had to say, well, what happened? Did they sleep under the nets? When they got fever, was it recognized? And once you sort of walked through the entire process, it was clear that what happened was the child got fever and the mother delayed, right? And then in the delay of taking the child to the health facility, someone said, "Why don't you take the child to the traditional healer?" And in that particular place, although frankly that traditional healer had been part of all the education programs, that traditional healer didn't make the decision to then refer the child to, again, the health facility. And so then the child started to convulse. While that child was convulsing back home, the other child, whose fever was advancing a little bit more slowly, started to advance. So they're running this child to the health facility while the other child's at home and not being carried to the health facility. So 2 children died. All because of behavior change that didn't happen on a multiplicity of levels at community level. It was sort of a fantastic community failure. And I bring it up because these are difficult challenges, but also because in that moment of engaging, as people were saying, well, we need more nets, we need you not to forget us, we need to ensure that we continue in this work, we also had to honor that passing of life from life into death, which is part of the gift, I think, in that particular community of the faith-based agents. So, next slide, please. Impact, of course, is that we've had great work in nets distribution. Those of you who have been in the malaria space know that there's a lot of anxiety about whether universal coverage and nets will continue as we go into the Sustainable Development Goals and move from the Millennium Development Goals. We can't just declare victory. We have a disease that's changing. We have a disease that we have to continue to engage with. And we now have communities that trust us. And that community trust needs to be listened to and also responded to on a consistent and regular basis. The faith communities are there. They can continue to provide the information up. We have over 115,000 community workers across the 17 countries of Africa that provide that information through the community networks. There are platforms to continue to engage this work. We're in the process also of now sort of shifting some of the conversation with those community workers to engage a full panoply of community case management on malaria, pneumonia, and diarrhea, which are the leading killers of children in these areas. Next slide, please. And we also, frankly, continue to engage in this policy discussion because, yes, the evidence has been brought. Of the 17 countries that we've worked in, we've been able to convince 5 that hang-up methodology is the key methodology. But changing policy, frankly, is not the end thing because policy has to be executed, because communities need to actually be able to be equipped and supported and responded to that policy because coalitions come and go and funders come and go. But at the end of the day, it's the faith-based folks who continue to be there listening to these children and families. So I again note time. This was an 8-year program and continues to function. I again note time. The coalition building takes time, trust takes time, but this is not over. I again note trust. People need to be able to talk about what the barriers are to why they're not doing something. And we can't just assume it's because they don't want to or they don't have enough knowledge. We need to talk through that with communities. And I again note this question of common vision. But my final note really is funding. none of this would have happened without money. It would have never happened without the support of the various church memberships, USAID, the Global Fund, UNICEF, all the various private actors I mentioned earlier. We need to all be in this together. So thank you.
Thanks, Abigail. And from the Angola example, we'll go across to the other Lusophone country in southern Africa. My other favorite bishop who fights malaria in Africa, Bishop Dinis Matsolo, who's executive director of PIRCOM, the interreligious program against malaria. You have about 5 minutes, 5 minutes, Bishop. Thank you.
Thank you. First of all, I really want to take this opportunity to say thank you very much for the opportunity to be here and share what is happening in terms of combating malaria in Mozambique. As I indicated the first day, for me, this is clearly a paradigm shift. It is a revolutionary move. I think the fact that we are here together, reflecting on those issues and trying to find ways in which religious communities can be engaged on sustainable development to end extreme poverty, it's really revolutionary. And I think if we move from intentions, from declarations to action, no doubt that in our time we can see change happening. So I think we ought to congratulate ourselves by being part of this revolutionary move. As you can see from the first slide, we're talking of various faiths united, trying to work together. So the issue of teamwork comes again. It's so crucial that we do work together. There are things that may seem impossible for each and every one of us to do by himself or herself, but it doesn't mean that it cannot be done. It only requires collaboration and a spirit of working together. And so I think working together is very crucial. And of course, for us to work together, we need to understand each other. We have to engage. There's an interesting African saying that goes like, if you want to go fast, go yourself. But if you want to go far or reach further, go with others. And I think we need to begin learning a way of moving together. And by doing so, we will see interesting results. There is value in doing positive things together. You will realize that in the context of religions, if we do things together, we end up overcoming prejudice against each other. And we can also develop other ways of intervention. Like in the context of Mozambique, we have been very much involved in the process of bringing about peace in the country as religious bodies. And in fact, that motivated us to come up with a PIRCOM initiative and say, if we manage to contribute to stopping war, guns, why can't we stop malaria? Why can't we stop mosquito? It's very small to be able to gain space if we come together. But if we work separately, then we'll end up not being able to do what we can do. So working together is very crucial. I will not speak much on the slide themselves because they are there and they can read easily. But I wanted to indicate that the basics, our strategic intervention is again on the issue of SBCCs, the change of the behavior. The behavior change is very crucial, because if you change your attitudes, in fact, by changing attitudes, we can reach many other things. In the context of Mozambique, to have malaria has become a normal thing. So, and what is abnormal is not to have malaria. And so we have to begin by changing that. You know, people have to understand that it's not normal to have malaria. And so you have to fight and seek ways of avoiding having malaria. And if you do have, then you have to seek treatment, because there is a possibility of treatment. It's interesting that the country has developed capacity to treat malaria. And therefore, if a person goes to the clinic on due time, will not die because of malaria. But then people need to understand that that is not a normal thing to have so. I wanted also to bring the second point, which for me is to say the involvement of religious communities in development is not an option, it's a must, it's obligatory. If we really serious about reaching the very needy people. Because religious communities are in places where even the government sometimes are not able to reach, but they are there. That is one. But the second thing, which is so crucial, is that when a religious leader speaks to all people. But when a politician speaks to his followers, which means that the others actually literally close their ears. No, they don't want to hear, because they always do a connotation of what he says with his political inclination. But the religious leaders speak for the well-being of all people, and therefore we can capitalize using that. And that is why we capitalize on training religious people to speak the correct language in terms of malaria prevention and treatment, so that they speak to all people. And then you can see our advocacy work, meeting with the president and trying to make a contribution on how can we fight against malaria together, because it's a joint initiative. We can't do it alone, but we can do it together. Capacitating religious leaders and the volunteers, you can see by yourself. But I also wanted to mention that the third point I wanted to mention is the fact that I tried to listen very carefully from the very first day, and there was kind of an indication that some people would say, are we to support the religious institutions or governments? And I wanted to say that my reflection is that it's not neither or, it's both. I think if we develop the understanding that we can collaborate and there is complementarity, then we'll see better results. It is about complementarity, not about either or. The fourth and last point, because of time, I wanted to mention the fact that we need to take a step, a deliberate step to move from intentions to action. I think that is very crucial. And John Burroughs put it very nicely when he said, the smallest deed is better than the biggest intention. We need to begin doing things. we can have very wonderful declarations, but if those declarations are not translated into action, nothing will change. We'll maintain the status quo. And let us be mindful that needy people need very much little, but they need that little so much. In other words, without that little, they die. So it's a matter of life and death, my brothers and sisters. Therefore, come, let us make a difference in our time. Come, let us be part of the solution. Let us be passionate activists on ending extreme poverty in our time. I thank you.
Thank you, Bishop Matsolo. So I hear a powerful call to action, and lunch is looming, and what we want to do is take just 8 minutes. I'm going to give myself 8 minutes to put you all into groups, stay in your groups, and reflect upon what you've heard from these great presenters, and see if you can come up with a few of those pesky recommendations for action. And we're not going to go through everyone to report out. I'm going to ask for 3 groups to actually share one. Trust that we will capture everything, and you will have opportunities to learn what people are recommending.
Yeah, just to say that in the table, there are these flies in Portuguese and English, and therefore, so you can start learning a bit of Portuguese. And then there is this a sticker that our volunteers use to identify the house that they visit for monitoring and evaluation following.
Muito obrigado. So, thank you. And we'll come back in just 7 minutes. Thank you. I'd like to ask Uli and Sandy to join me up here again for a final observation each, and then I will free the way to lunch.
Andreas was so kind to give us 1 comment each. It's impossible because, I mean, if after such an enriched discussion, but I do believe there's a huge task in front of the co-hosts and the steering committee to really follow up all these recommendations with a clear mandate from the floor here, and to look in one specific issue, and that is how do we bring together these different layers in the process, from multilaterals, bilaterals, donor community, intermediaries, and then down to NGOs, CBOs, FBOs, not down, up. Because, you know, it seems that these FBOs, religious organizations, they have the convening power, they have the credibility to reach out to households. That's what we learn. So, but even if World Bank and other intermediaries, interface groups, whatever, want to fund them, they have to take these different requirements into consideration without instrumentalizing, but by strengthening the specific accessibility, credibility that FBOs bring on the table. That's my recommendation. Thank you. Or observation.
Thank you.
Just another quick observation to add. I think the first is the, and we've heard it over and over again, is the focus on data. We have to measure and we have to communicate the results of what we do. Innovation and creativity are so incredibly important, and we heard a lot about that. Leveraging existing resources to bring programs to scale, really critical. But I think the thing that is most important, I think, in all of our conversations and that we ought to follow up on is this issue of communication. And communication, I think we're challenged in our communicating the results and the work that we're doing in collecting the data and so forth, but it was clear that we aren't just challenged in communicating externally, but as we scale up, we become challenged to communicate internally, amongst ourselves, which I think is really, really important when we talk about going to scale, and I hope we'll be able to follow up on that. And
Great.
Jean, thank you so much.
Thank you, Sandy, and thank you, Uli. Thank you, all the presenters. So I just want to close by saying scale is happening, and it's not necessarily easy. We are learning things, and USAID, World Bank, Global Fund are actually funding some of this work, so that means it's possible, right? So let's keep that going. And thank you all. Lunch is that way for those who aren't fasting, and I thank you all.